Hello guys, welcome back again on my YouTube channel. Today is another great day for our eye health essential, and a very good thing I want us to discuss today concerning our vision is this eye condition called glaucoma. Okay, or in another term you can put it as a silent theft of sight. When we say the silent theft of sight is because the condition is not painful, but it attacks the nerves that connect our eyes to our brain. It's through this nerve that you are able to see me and I'm able to see you, and you are able to identify your environment. And so when this nerve is tempered with, you are going to have vision loss, and this vision is one that is gone forever. All right, and so if you have been diagnosed of glaucoma, please make sure you follow up. Now, concerning the causes of this glaucoma, in most cases glaucoma, the cause is unknown. Only related factors that can make you to have be defined of this eye condition. The very first thing is eye pressure. When you are having an eye pressure that is not normal, that is higher above normal, they'll begin to suspect you of glaucoma. Okay, so who is at risk of having glaucoma? If you are 40 and above, know that you are at risk of developing glaucoma. All right, family history of glaucoma is another factor that can make somebody to have glaucoma. In a lineage where there is glaucoma, all right, your generation can easily grab the glaucoma, and the chain like that of having glaucoma, it continues. All right, those that are having diabetes. So if you are a diabetic patient that has not been visiting the hospital, know that you are at risk of having glaucoma. It is high time for you to visit the hospital. Make sure you follow up your treatment in order to stay away from this silent theft of sight called glaucoma. Another person who is at risk is those that are having hypertension. If you're having hypertension and then you take it like a laissez-faire, you don't care, you eat, you don't go to the hospital, or you are somebody who is already with treatment and don't consider your treatment and don't take things serious concerning your health, know that you are at risk of developing glaucoma. It is high time for you to be on alert and follow up your treatment. People that are using steroid medication with no control, know that you are at risk of developing glaucoma. Don't allow the silent theft of sight to steal your sight for life, because when you are in darkness, you will be in darkness forever as long as glaucoma is concerned. All right, so make sure you follow up and make sure you go for regular eye checkup in order to follow up this condition. If at all you are somebody who is already taking treatment, or you have been diagnosed and then you don't take the rendezvous or the diagnosis or the diagnosis that the doctor have explained to you serious, make sure you follow up. If you have trauma and you don't follow up for your eye treatment, especially trauma that concerns the eye, that is where you can easily develop eye pressure, and that pressure will be mounting on that optic nerve. When you mount on that optic nerve, you are in trouble because it will cut the optic nerve, and when you cut the optic nerve, which is the focal point in which it can make your vision to be better, when you cut it, that is blindness, and when blindness set in, it's blindness for life. So take note and follow up your treatment. All right, now some symptoms when you have glaucoma, what will you experience? Some people have problem with peripheral vision. We'll talk about peripheral vision, meaning that you'll be able to, when you sit at a certain point, to see your surrounding. It will be difficult. You cannot identify objects that surround you. All right, your peripheral vision begin to diminish. It will diminish gradually. You will be seeing things that are only centralized. You will see. Another factor is that you have blurred vision. All right, blurred vision. Your vision will appear blurred. You'll be seeing halos around light. Right, when you are progressing with this glaucoma and you don't take it serious, when it's towards the advanced stage or towards the end stage, you will find yourself bumping into things. You will see a valley, you think that is a plane. that is how your legs, you will just be jumping like that. So this condition is not the friend of anybody. If you have been diagnosed or been termed a glaucoma suspect, take it as a serious issue to deal with, because when you are blind with glaucoma, you are blind for life. Somebody asked me that how can we prevent this glaucoma? The very best way for us to prevent this glaucoma is when there is early detection. When there's early detection, management will automatically take place, whereby there will be sustainability of your vision. Even the Bible says that when your body is in darkness, every wall of yours is in darkness. So please stay tuned on this page. Don't go anywhere. Remember, each topic is being good for you to follow up and also share with your friends, your family members, even the grandmas, because I don't use terminologies to share eye health, right? With terminologies, it will be difficult for some of them to understand what I am telling you guys every day. So stay tuned on the page. Don't go anywhere. I like you guys so much for what you have been doing. Thank those that have been watching. Thank you for staying tuned on the page. I love you. Don't forget to like. Don't forget to subscribe. Don't forget to share. Stay tuned. I love you guys.